And now, please welcome Anurag Hans, Head of Mission of Essilor-Luxottica and President of the One Sight Essilor-Luxottica Foundation, Dr. Wanjiku Mutenge, Founder and Director of Training and Research at the Rwandan International Institute of Ophthalmology, and Dr. Magda Robialo, President and co-founder of the Institute for Global Health and Development. This conversation, Seeing the Bigger Picture, Universal Vision, and the SDGs, is moderated by Maggie Lake, veteran journalist and founder of Maggie Lake Media.
Loud voice. So, okay, there we go. It's great to see everyone. We are going to be talking about vision, and it was a fantastic last panel, and we're going to jump from donkeys to AI, if you can believe it. It's going to happen. So, but that just gives you an idea, I think, of the breadth of this topic. So, welcome to all of our panelists. Thank you so much for being here today. Dr. Robialo, if we could start with you. When we talk about the SDGs, and of course, that's the overarching theme of why we're here this week while the UN General Assembly is going on. When you talk about the SDG, health and well-being, vision isn't always the first topic that people jump to. Can you make the connection for us?
Well, you are right. Very often, what people think about as diseases that need to be immediately addressed are infectious diseases because they are much more contagious, they cause high-level mortality, and the SDGs are driven by the major infectious diseases that afflict populations, particularly in poor, low, middle-income countries. So there is actually very low visibility about diseases that cause high burden, make people lose productivity. I can, for example, talk about trachoma, which is the leading infectious disease that causes vision impairments and blindness, which can cause up to $8 billion loss on economic productivity. Very few people actually know about this. And it's endemic in about 42 countries. You can have up to 90% of school-going children infected. So, unfortunately, the center stage is taken by HIV/AIDS, tuberculosis, and malaria, rightly so, because they have caused so much havoc. And these days we talk about COVID-19, we talk about Ebola. Infectious diseases that are spreading around tend to be more prominent in the global agenda. But we really need to bring closer home issues like blindness, visual impairments, because they cause a lot of suffering and push people into poverty because of inability to work, to go to school, to learn, and to do care for their daily lives. We need to make sure that the reinvigorated agenda after this UN General Assembly, the 3 health summits that are occupying a very good space in New York this week, when we think about universal health coverage, we don't just think about maternal mortality and infectious disease and child health. Those are important issues that we need to talk about, but we also need to think about the other diseases that are neglected. Everything cannot be a priority, but if we strengthen health systems, if we implement primary health care, we will be able to reach those people. These people are very often at the last mile where no one goes. They don't have access to health facilities. They don't have access to health care. And if we implement universal health coverage based on primary health care, we should be able to reach these children, these women. Trachoma affects 4 times more women than men. Very few people know about this. And women actually takes care of children, the household, and all that. That's a lot of loss for societies. And we hope that the more we talk about and bring this data to the fore for people to know, for people to speak about it, and we bring people of communities that are affected to lend their voice and ask for more support, we should be able to also address these issues while we tackle genders who are occupying our agenda right now, and rightfully so. I'm not saying let's not talk about or do something about HIV/AIDS, tuberculosis, and malaria, because we need to do trachoma and river blindness and etc. But we can address many other diseases at the same time if only we change the approaches that we have to healthcare and care for the needs of poor people in their communities.
Absolutely. And as it is the case with so many of this, it intersects several SDGs, right? You're talking about gender equity. We're talking about economic mobility and well-being. Dr. Muthenge, Dr. Obola mentioned COVID-19. What is the state of vision healthcare post-pandemic now? What's happening on the ground?
Okay. Thank you, Maggie. So I am an ophthalmologist, and I work in both a public and a private hospital. But I'll start with some numbers. So there are about 40 million blind people in the world. People don't think about those huge numbers. If you add people who have visual impairment, which includes everybody wearing glasses in this room, then the numbers jumped to billions. And most of those people live in low and middle income countries. They are female, and they're in rural areas. 9 out of 10 people who have visual impairment or blindness in the world don't need to have it. Their diseases could have been prevented or can be treated today. And the reason they remain like that is because of lack of the human resource to deal with those diseases or lack of supplies. Now, of course, COVID made all those things worse. There were breaks in the supply chain, and access to services was just not available. Operation rooms were not working, and people with conditions that need regular care really deteriorated, and the numbers ballooned. However, COVID also brought us some hope, because in the world of ophthalmology, we started investing a lot in telehealth, and including solutions like artificial intelligence. Even in countries like Rwanda, we had to start thinking of those kind of solutions.
That's amazing, and I want to talk more about that. Anurag, Magda said everything can't be a priority. How is the private sector thinking about vision? Because I think that, and how it fits into SDG strategy, because it's true, at some point this becomes a resource game. So how are they, and how should the private sector be approaching this?
Well, so I head One Sight EssilorLuxottica Foundation, which is the largest foundation focused on uncorrected refractive error, which is a subset of the vision issues that we're talking about. The fact is that 1 in every 3 people cannot see clearly, a condition that can be corrected through a simple eye exam and a pair of glasses. And we believe that being able to see clearly is a basic human right. Now, having said that, the solution to the problem of uncorrected poor vision is not a solution of counting the billions of people who need that service. The solution is about creating capacity, because specifically around refractive error, even if you distribute the billions of glasses that are needed, the fact is that in a year, prescriptions will change and people will need another billion. So the problem is not about counting how many of those billions have we corrected. The solution is how many of them have a permanent place to go to get an eye exam and to get an affordable pair. And that's the path that we are taking. For EssilorLuxottica, which is the largest player in the field of lenses and eyewear, this is just an extension of our day-to-day work. We change people's lives every time somebody puts on a pair of glasses, and we believe that should be true for everybody around the world, irrespective of where they live. So for us, it's not a stretch. It's not something that we have to do just so that we are able to check off the SDG box. It's a plain and simple extension of our mission to help everyone be able to see clearly.
If I'm listening to the three of you, it sounds like, and I love the point about capacity, because you're right, as somebody who's been moving up the food chain with my own my own prescription, it's true. It's something you have to do again and again. So that's a great point, as opposed to just handing out the glasses, because I think we've all encountered those programs. It sounds like you're all saying that this is solvable, though. Am I hearing you all correctly, that this is not we need to find a cure, it's that we need to increase people's access? Is that the case? Yes.
So I'll give you my point of view. I'm a huge optimist, and I believe that this is not going to be an issue that we will be sitting in this room talking about in 10 years' time. So there are many problems in the world which afflict billions. I can tell you that uncorrected poor vision, especially refractive error, which contributes to 90% of all vision issues, will not be an issue that we'll be discussing in 10 years' time. The reason for that is also linked to what Shiku was saying about the impact that the pandemic had. On the downside, we've seen that because of increased screen times, myopia rates have gone up. But the plus, the positive of the pandemic was that a lot of countries have had to move on, let's say, telehealth policies that they've been sitting on for a long time. And because of that, now telemedicine is going to become the standard way of delivering care for uncorrected refractive error in the rural parts of the world. In fact, I would like to say that the rural regions of the world are going to leapfrog and completely skip the stage of creating these physical access points with physical technicians who are based there, and would completely bypass that stage. And then we're only talking about scaling up the platforms of teleconsultation and telerefraction that are already there.
I think a lot of people are going to be surprised by that, because a lot of our experiences, and I don't know, you can nod in the audience if it's true, is that you go to get your prescription renewed, you go to get your eye checked again. I see you, Shiku, nodding your head vigorously. Are you seeing this happen on the ground with the work that you do, and what does that look like? You mentioned AI before.
Yeah. So like I said, one of our biggest problems in the world of eye care is trained personnel. And where I work, we have very, very few ophthalmologists. And unfortunately, the leading causes of blindness are, in my part of the world, it's cataract. In your part of the world, it's age-related macular degeneration. Those are diseases that need ophthalmologists. So our strategy is let ophthalmologists do what only they can do, and then find solutions for other tasks to be done by other people. And so in Rwanda, or in Africa, what we are doing is we are running a primary eye care program where we train nurses in the frontline health facilities on how to do a basic eye examination. So, nurses can do a lot of things. They can deliver babies, so checking an eye is not that complicated. So we teach them how to basically separate a normal eye from an abnormal eye, and then the abnormal eyes decide, what can I treat? What do I need to refer? What do I need to give first aid before I refer? And then we give them the skills to do all that. And in Rwanda, we've trained 2 to 4 nurses in every health center. And already what that does, it brings eye care within 5 kilometers of every household. On the other side, there are diseases where we need people to be found early and come for care to the ophthalmologist, and that's where technology comes in. So I'll talk about a disease like diabetic retinopathy, which is a complication of diabetes. We need to examine the retina to know that this person is at risk. We don't have enough people who can examine the retina. So what we've decided is that let's rely on technology. So in Rwanda, we want to put in cameras into diabetes clinics, take an image of the retina, upload that to artificial intelligence, and then you get a yes, you need to see a doctor, or no, you're fine for another year kind of report. And we've already tested this, and we are implementing it already. So we are going to skip the reading center ophthalmology pathway that is what is followed elsewhere, and probably just go directly to this if we can afford it.
That's amazing. And something I think when we talk about AI, we know it snakes into every conversation, but this is a really tangible example and probably something most of us were not aware of. Magda, you talked about the last mile. There are obviously these innovations, technologies moving quickly. How do we work on accessibility and what's needed in terms of that?
Thank you. I hope I didn't leave the impression that everything is a priority. I meant that we can't make everything a priority, so we need really to strategize. But if we have the right approach, we can tackle many more diseases than we are currently doing. What she has just described is the strategy that we need. We need primary health care. People need the care for the symptoms, the disease they have, as close to home as possible. Unfortunately, we have a major problem with human resources, health workers. We would have loved, many African countries would have loved to train the nurses to also do high check. But these nurses are overburdened, underpaid, they have poor working conditions, and it is difficult to add something else on top of what they are already doing. That's why it is important to invest in the healthcare workforce. It is important to find the fiscal space, the financing that is required so that countries can expand the healthcare workforce and provide the kind of services close to the rural areas, close to the last mile. Most visual impairments are preventable. I want to believe they are the experts. And if we do address social determinants of health, if we address access to quality water, if we address quality access to sanitation, better housing conditions, a lot of these diseases will just become things of the past, just like they have become a thing of the past in developed countries. So there are several SDGs within the 2030 agenda that will need to work together in order for us to achieve the outcomes that we expect, not just SDG 3. So apply primary healthcare strategies, bringing care closer to where people live, improving their living conditions, and then giving them the ability to also participate in decision-making about their home health, not bringing the technology, the innovation, and say, this is what you need, but listening to them and then making them be part of deciding what are the most important things for me today. Sometimes they don't even think of their health. Sometimes it's food. Sometimes it's education for the children. So this is where we really need to make sure that the intertwined dynamics between the 17 SDG goals work for the people. The public-private partnership is very important. There is no government in the world will be, particularly in low and middle income countries, will be able to solve this alone. There is no way we'll be able in 10 years to have high-tech access to care in most countries, because you have rural areas where there is no electricity, there is no water. There's no way you can actually apply telemedicine and all these. I don't want to call them fancy because they are very simple, but for people in those areas, it's actually fancy technology. We want to be there. We have to leapfrog. Africa and other low and middle income countries don't need to go through the painful steps of development. We can really jump steps, but of course it takes proper governance. It takes pro-equity governance. It takes leadership. It takes vision, not just vision to see, but vision of thinking into the future. And that's where sometimes we have problems with our leaders.
This is where the issue of awareness becomes so important, so that you can address this from a holistic point of view, right? Nothing is in a silo. And if you take that approach, you can often address many of these issues at the same time and pool resources for that. I think we have a question from the audience.
Sorry, I'll just project. So Lori Garrett here in New York, she wants to know, with organizations like Vision Spring that have distributed millions of sets of reading glasses all over the world, do you think that that sort of an approach should be part of this conversation? Are there downsides to that?
Anurag, I think you're in a good position to answer that.
So I think the process of what I said, building capacity to do this over and over again, is almost like, if I had to draw a parallel, it's almost like erecting mobile towers or laying the cables for high-speed internet. Once you do that, then you can deliver affordable products to people who can afford. You can distribute for free for people who need philanthropic help. But it's important for you to have created that capacity. Distributing free glasses has its place in the world, but I don't think that will solve the need for more than 20% of the entire population that we're talking about. Now, just to link it to the point about AI, I think a lot of times the conversation gets lost between, is AI going to replace a human who's right now doing a job? But in these contexts that we're talking about, AI is actually going in and filling up a gap that was not occupied. So as we speak, our teams are, I'm giving you an example, our team is deploying an AI-powered chatbot, which is interacting with people living in rural areas in Indonesia, answering questions, basic questions about vision care, and then directing them to the nearest vision care point where they can get an eye check and a pair of glasses. Similarly, predictive models based on big data is drastically going to reduce the complexity of this entire chain and the time taken. And this is not something which promises to be in the future. This is something that is happening right now, not in the top urban centers of the world. This is something that is being deployed by us and many of our government partners in areas where right now there is no capacity. So, yeah, so again, to your question, it's about building capacity. Now, that capacity will look very different from the optical points that you see here in New York. It's going to be digital centers which are overseen by an optometrist or a refractionist sitting miles, thousands of miles away, but delivering the same standard of care closer to where the people are living. So.
And it's a matter of short term, and then it sounds like the medium to long term, building that capacity. Do people who can't see need those glasses now? Absolutely. Is there a place for that? Absolutely. But if you want to solve the problem for the future, then access. We're almost out of time, but Shiku, I'd like to have leave you with the last word. As somebody who's a practitioner on the ground working hard to solve this. And I think we've heard about the importance of private-public partnerships. I mean, they're essential to all of the SDGs. What do you need? What would you like to see? What do we need to do? I mean, what do those public institutions, as well as the private sector, with the financing they bring, need to do to help move the needle on this?
I think, investment in training people, because, money can buy hospitals and drugs, but it can never buy the trained doctors and nurses that we need. As you said, I think there's a role in distributing free glasses, but I would rather see manufacturing plants opened in Africa. There's not a single spectacle manufacturing plant in Africa. Why is it the most complicated thing to manufacture? It's not. So I would like to see investment going that way rather than...
That shocked a lot of people, when you just said that.
Yeah, and our spectacle frame is a piece of plastic, and the lens is a piece of plastic too. I'm sure we can be taught how to do that. So rather than spending so much energy distributing free, I wish that energy would go into creating at least a factory. Yeah, thank you.
And Magda, same thought from you. What's needed, especially with your view on the larger healthcare system? I heard you talk about universal health care several times.
Universal health coverage is a topic that will be subject to leaders' conversation for a political declaration tomorrow. And we want to believe that within that frame, there is room for infectious diseases, non-communicable diseases, and high care meets both agendas. But most importantly is the issue of partnerships between to global north and global south, the public and the private, with communities at the center. That only will be able to enable countries that are left or are staying behind to leapfrog, like I said before, and provide the care that people need. We are talking about local manufacturing of medicines, diagnostic vaccines. We are only thinking infectious diseases. And she just said something very important. Why can't we produce spectacles in Africa and other low-income countries? So we need to broaden our thinking. We need to think beyond infectious diseases and the things that we have currently in the box. And stages like this are very important. I'm really pleased to be part of this conversation where we are talking about something different, unusual for me to talk about. Even though in the world of infectious disease where I navigate, I know neglected tropical diseases cause visual impairment and blindness, but we need to do more of this. We need to bring these neglected areas of essential care to the fore so that those who think about broad issues, shape global policies, think better and include such important pieces of work into the agenda for everyone, because there are billions of people who will benefit from just improving the access to care. And if you train that we need to do, healthcare workers, they will also be able to take care of our high side, which is so important.
It is. And Anurag, very quickly, I think you should leave us with the sentiment that, again, this sounds like something, all of us are talking about these big issues, that there can be quick progress on this. This can make a difference almost immediately.
Yeah, I think as I started with, the issue of uncorrected poor vision is most likely to be the biggest success story in the field of public health care. And I'm very optimistic and very excited about the role that technology is playing in creating capacity to solve what is probably the biggest disability in the world. Sometimes it's easier to paint a new picture on a blank canvas than to correct something which already is existing. And I think we have that opportunity, and we already have the models which work. With new technology coming in, they're just getting better.
And that will be a generational change. Thank you all so much for shedding light on this.
But will not likely take a generation to solve.
Exactly. So I hope you all feel empowered and inspired by that. Thank you so much.
Thank you.
Thank you.
Thank you.
Nice.
Thank you. Go off this way.
So much.
Please welcome to the stage Deputy Executive Director of the United Nations Program on HIV/AIDS and United Nations Assistant Secretary